Well, in fact, the first reference of a possible microbial role in association with celiac disease was done in the 80s by studies by Martin Kagnoff showing associations with viral infections. And since then, and the interest in the gut microbiota in many other diseases, some clinical studies have shown an association with alterations in the gut microbiota, specifically the one that inhabits the upper gastrointestinal tract, and celiac disease. So these are mainly structural or functional changes in patients with celiac disease compared with healthy controls. Well, that in fact is the key question, because the clinical studies, they show association, but they don't show mechanisms or causality. So in order to do this, we have to combine clinical studies with more reductionist approaches. And for example, in my lab, we have found that patients with celiac disease have certain bacteria that metabolize gluten differently from the patient that healthy controls harbor. And so if this is so, then this could be a mechanism by which different gluten metabolism affected by the different bacteria that celiac patients or healthy controls have could affect the immunogenicity of these peptides. The most obvious consequence would be to be able to target these microbially driven mechanisms to either prevent or to better manage the disease. And although most patients with celiac disease will respond to the gluten-free diet, there is a proportion, up to 30% of patients, that are non-responders. And it is this proportion that has also alterations in the gut microbiota. So perhaps we could add microbially driven therapies to the gluten-free diet to better manage these patients.